Okay.
So first I'm gonna assess if it's midline on your body, of which it is. The next thing, I'm gonna palpate if there's any. Gonna tell me if you have any pain, okay?
Okay.
Palpate if there's any deformities, any masses, any pain.
No.
Alright, so the next thing, I'm gonna palpate your cervical nodes, okay?
Okay.
Tell me if you have any pain, okay?
Okay. No.
Looking at if there's any enlargement, if there's any cervical node that is palpable. Alright, there's no palpable or movable or enlarged cervical node, okay?
Okay.
Alright, so the next thing, I'm gonna assess your carotid artery and check if there's any. Just relax. Regular pulse, pulsation. And assess on this other side. Which is nice and regular compared to the other side. So it's normal. The next thing, I'll assess the roots from both of your carotid arteries. Now roots. The next thing, I'm gonna assess your jugular vein, your external and your internal jugular vein. But I can assess it when you're sitting. Okay, so we're gonna come over and sit down here. And lay down so I can be in a position to access your jugular vein. Okay.
Okay.
So with your head raised, I can be in a position to assess your jugular vein. And I can see it's not distended, your external jugular. I'm gonna try and see if I can access any pulsations of the internal jugular. Just right there. And then go ahead and listen. And clear. Alright, Mr. Jared, I'd like you to take a seat for a moment because I want to go ahead and access your posterior and anterior chest, but I think the best position can just come over here, just a little bit of time. And please, if you don't mind, would you like to take off your shirt so I can be in a position to access your chest? So I'm gonna start with your posterior chest. So if you're going standing up, then face on the other side so I can access your posterior chest. Your posterior chest. Number one, I'll assess if there's any, if there's equal thoracic cage symmetry, of which I can see it's equal. I'm gonna assess if your spinners, your spine is straight, of which it is. I'm gonna access how your downward sloping of ribs, if it's equal on both sides, and of which it is equal. So I'm gonna go ahead and palpate. Any pain?
No.
Alright, so the next thing I'll go ahead and I'm gonna do a chest expansion symmetrical test. So I'm gonna calm down. Okay, go ahead, just be relax.
Okay.
Just relax. So I'll come down to your T9, T10 spinal, you know, and to the end of your T10, T9 thoracic spine. And what I'm gonna do, I'll like come over and pinch a little bit of your skin fold and ask you to breathe in and out again. Alright, that means, one more time please. Good job. That means when you breathe in and out, my hands expanded uniformly on both sides. That means your chest expansion is symmetrical on both sides. Okay.
Okay.
So the next thing, I'm gonna do a tactile parameters test. And every time I move my hand, I'm gonna ask you to say a number like 99 so that I can know if the vibrations of the sounds are equally on both sides. Okay?
Okay.
Alright. Go ahead and say 99.
99. 99. 99. 99. 99. 99.
Good job. It means your sound is just distributed equally on both sides of your posterior chest. Okay?
Okay.
So the next thing I'll do, I'm gonna go ahead and percuss, and so that I can know the how normal your lung sounds are. Okay.
Okay.
All right. So. And you can notice this sound is low pitched. It's low pitched because you know your lungs are filled with air spaces, which is resonant sound, which means your lungs are normal. Okay.
Okay.
All right. So the next thing, I'll go ahead and auscultate your lungs, and every time I move my my stethoscope, I ask you to breathe in and out. Okay.
Okay.
In and out. The lungs auscultation, there's no non-labored breaths, and they're all symmetrical. So the next thing, I'll go ahead and do the diaphragmatic excursion test, of which I'm gonna tap from the highest up and down, so that I can make so that I can know where your diaphragmatic excursion lies. Okay.
Okay.
All right. So I'm gonna do it. So it's on resonance there because of the lungs. But the more you move down, it becomes dull. So I'll say my diaphragmatic excursion lies right here. So do the same on this other side, of which you can hear it's an excursion, but the more I move down, it becomes dull. So I'll say my diaphragmatic excursion lies right here, of which that would be my mark of the diaphragmatic excursion. So the next thing I'll go ahead and do the anterior chest, of which you can go ahead and sit down. On the anterior chest, I'll go ahead and assess first the thoracic cage and see if its symmetry, of which it is. It's equal on both sides. The next thing I'll go ahead and do the tactile parameters, like I did, on your posterior chest. And I'll avoid the bones, so I go ahead and you say 99 so that I can be in a you say 99 so that I can be in a position to know if your sounds are equal on all sides. Okay.
Okay.
All right. 99.
99. 99. 99. 99. 99. 99.
All right. It seems it looks like your sounds are equally distributed on both sides. Okay. So the next thing, I'll go ahead and do the auscultation. I'll do the auscultation, then do the percussion next. So I'll go ahead and assess your breathing sounds, and every time I move my stethoscope, please take a deep breath. Okay.
Okay.
Just relax. Take a deep breath. Clear clam sounds. It's not labored. It's cool. So the next thing, I'm gonna go ahead and do the percussion test, of which I'll go ahead and percuss, different all along your lungs, and see if I can find any abnormal sound. Okay.
Okay.
Alright, you notice the time when I move towards the heart, there's a dull sound because of the heart location. So I'll request you to come lay down right here. Alright. Just relax. I'm gonna assess your heart, and I'll go ahead and do listen to some sounds. Check if you have any extra heart sounds or any murmurs. So I'll go ahead and locate the sternal notch right here. Then I go down to the angle of Louis. Then count. Then I'm gonna count 2 ribs down, and that's where I can listen to my aortic heart sounds. Okay.
Okay.
So I'll come here, listen to my aortic area, then go back to the aortic. Go back to the sternal notch, to the angle of Louis, to internal, to go down 2 ribs, and I'm gonna listen to my pulmonic area. Listen for the S1, S2 sounds. Go down. I'm gonna go to the Erb's point, then go down to my 4th intercostal space and listen to my tricuspid area, then go down and listen to my mitral area. Okay.
Okay.
So. So after my tricuspid area, I'm gonna come to the fifth intercostal muscle, fifth intercostal space, mid-clavicular, and assess the mitral, the apical pulse. Right here. Jared. So, in my judgment, what I noticed is I can hear the S2 sounds on your aortic area and your pulmonic area. Your S2 sounds are louder. The dub is louder than the S1, and the more I move down to the tricuspid to the pulmonic, the S1 is louder, which is a loud sound. That means your heart sounds are clear and they are normal. I didn't find any murmurs and there are no extra sounds in your heart. Okay?
Okay.
Alright, that's a good sign. So the next thing, Jared, I'll go ahead and assess your breast. Would you please sit down? I'll go ahead and assess your breast and see, check if they are equal bilaterally. I'm gonna see if the nipple is aligned, at the center of your breast. I'll go ahead and palpate. Tell me if you feel any pain. You feel any pain?
No.
Assess for any mass. Assess for any lumps. Alright, I'm gonna go ahead and check if assess your nipple. Check if there's any discharge. Alright, and it seems your breasts are, normal, no enlargement, which is a good sign, okay?
Okay.
Alright, the next thing, Jared, I'll go ahead and do your abdomen assessment, which I'd request you to lay back. I'll go ahead and assess your abdomen. Just relax your hands. And I'll check if you have any scars, assess of any scars. I'll go ahead and check if you have any lacerations, any striae. Check your umbilicus, which is medially located, which is normal. Check the hair distribution, which is evenly distributed, which is normal. Then I'm gonna go ahead and check if we have any visible pulsations at the epigastric area, which is normal because of your aorta. So it's normal, it's visible. The next thing, I'll go ahead and auscultate your bowel sounds, okay? On all 4 quadrants. And do you have any pain in your abdomen?
No.
Okay, I'll go ahead and auscultate. Wow, it's on time number. Alright, Jared. Your bowel sounds are normal on all 4 on all 4 quadrants of your abdomen. So the next thing, I'll go ahead and palpate. I'm gonna go ahead and palpate your abdomen. Now let me first percuss your abdomen and listen to any, and check if there's any abnormal sounds, okay?
Okay.
your sounds are you notice the time. I noticed the time I moved to the right side of your abdomen. It's more dull because you know the location of your liver, and the more time I came to the left side because of this spleen. That's why you know it makes that dull sound. So your abdomen sounds are clear. No abdomen, so I mean no abnormal sounds. The next thing I'll go ahead and palpate, and in case you feel pain, let me know, okay?
Okay.
First I'll do a light palpation. It says if there's any lumps, any pain.
No.
You okay?
Yes.
Okay, the next thing I'll do a deep palpation, and it says if you have any abnormal enlargement of of your inner organs. Okay?
Okay.
Check if there's any liver enlargement. Check if there's any splenic enlargement. Any pain?
No.
Any pain?
No.
Alright, Jared, that's a good sign, you know, your abdomen is healthy. So the next thing, I'll go ahead and assess your inguinal and your femoral pain. I mean your femoral pulsations, okay?
Okay.
Let's try and locate it again. You got pain?
No.
I'm gonna see if I can palpate any inguinal nodes of which
No.
I can't see. I didn't feel any nodes. Okay.
Okay.
All right. So the next thing, I'll go ahead and inspect your extremities, your upper extremities and your lower extremities. Okay.
Okay.
All right. So I'll ask you to first go ahead and sit down.